Hey lovelies, it's Mari here. Excuse the hair, it's like having issues. We are currently at this moment having a bunch of thunderstorms here in beautiful Orlando, Florida. This is a quick update. I this week I've been like to one doctor, to another doctor, to another doctor. It's been really crazy. But I'm gonna explain to you a few things that my doctor clarified for me today. I had a doctor's appointment with my GYN. This video is more for ladies. Excuse the gentlemen, but basically it's just for us girls. Okay, I spoke to my GYN and he told me that I'm doing fine as far as lady parts go. He did bring up a very interesting thing. I had posted on, I think it was SJ's picture from Instagram about crossing legs, and I was correct. I asked my doctor, when we lose a lot of weight, the way our body is, and I'm a massage therapist, and I know this because I used to tell my patients and my clients a lot. For a woman, crossing her legs is really well, and for anybody, but what's crossing your legs and driving too long without getting up and walking out and stretching is really bad. You can get blood clots. You can get a blood clot that can detach itself and go up to your lungs, and it's called a pulm, an embolism, pulmonary embolism. So it's very important for us because once we lose weight, believe it or not, all that fat that we had is gone. So now when we cross our legs, we tend to put a lot of pressure on our veins. And believe it or not, your body right now is malnourished. It's just in shock and it's going through a whole bunch of stuff. And it's a lot easier to get these pulmonary embolisms due to blood clotting from your crossing legs a lot. So ladies, please try to avoid doing that as much as possible. Another thing is, this is a lot of TMI that I'm gonna give you guys, but maybe you're experiencing it and you really didn't understand it. But my doctor's, he's the kind of person, my GYN anyway, he is very blunt. He's very forward. He doesn't beat around the bush. He tells you things to your face and for you to understand. Um, Women, we had a lot of fat, and now we don't. And the lining around our vajayjay has dramatically changed due to lack of fat. So we get a lot of thinning around there. And some women experience a lot more vaginal discharge to where it's more easier to get a lot of yeast infections and urinary tract infections. And some women, fortunately me, get the opposite effect, vaginal dryness, and it's bad. He says I'm healthy, thank God. Nothing crazy going on, but he says that, yeah, a lot of when you dramatically lose a lot of weight, it does do that to the woman's body, and it can create either too much discharge or not enough, and it can create a lot of dryness, and that's my case right now. But he says it's an easy fix. It's not life threatening. It's something that's very easy. Another thing that also is happening, I had to get blood work today. I was supposed to do it last week, but I procrastinated, and I actually went today to do it, and it has to be fasting because they want to make sure that my A1C is correct and all my CBC and all this other stuff. And he did a in-depth on my nutrition, on the vitamins in my body. Another down effect about weight loss is your veins are a trip now. They become rebellious. I was literally poked here, I was poked here, and then I was poked here just to draw blood. Because now my veins don't want to give blood. And I was talking to some people and they said yes, that they've noticed that happens a lot to women that have had, and men that have had dramatic weight loss. So these are little things on the downside, besides the chafing in the legs and the crepey that you get in your skin. You get crepey, which is like wrinkly. I use Dr. Beverly Hills cream. I don't promote creams, but I use Dr. Beverly Hills because it's helped me, per se. Plus this lotion that my dermatologist sends me. I'm using, obviously, I'm going through my issue with my hair loss. It looks nice sometimes, but it's so thin. I have a bald spot back here, and I have another one over here, and one back here, which I flip around my hair as much as I can to try to cover it. I usually keep my hair up on a clip because I'm definitely afraid to brush it. It's literally falling off in chunks. So recap. Women can tend to get more dry. We get more chafing. Crossing the legs is not a good thing. We get crepey skin. We obviously getting hair loss. And the most important thing is, keep up your vitamins. That's why I put on this video is mostly for women because, hey, we're it. And one more important thing. I have to redo my breast mammogram, and he says that it's gonna hurt more because now it's just less skin and it's gonna flatten it more. So he says get ready for that. He was really nice about saying it to me. He was very, he understood me as a woman that it was gonna hurt, and he's a guy, so it was awesome. He says that weight loss surgery is a tool to lose the weight, but now we as patients of weight loss surgery have to train our brain to accept all the other things that come along with it. So ladies, more power to us. Let me know, let me know if some of you are experiencing some of the stuff that I am, or maybe it's just me, who knows? Life is like that. The crazies come on after you do radical stuff to your body. Anyways, please give me a thumbs up, subscribe if you haven't. I love all you guys. You rock. Love you guys. Bye.